You know, another lady that, I don't know whether you know, I-Chun.
Yes.
Yeah. So what happened was in May of this year, May 31st, World No Tobacco Day, right? So since before May, in March, I was already trying to do up an episode. So I had in mind an episode on World No Tobacco Day. I wanted to do this topic on tobacco. So on LinkedIn, I saw that I-Chun is always, posting about, she's very passionate about, so she's an advocate, right?
She is, yeah.
She's very passionate about this secondhand smoking, on Neighbours, smoking. And so I messaged her and I told her that, on World No Tobacco Day, I'm trying to do a special episode. Would you be willing to come on and share your experience with tobacco control? Because I also see that you have been contributing actively to the forums and all. And then she said that she's a bit camera shy, media shy. But instead she would...
in writing, she isn't.
Yeah, she isn't. Right?
She's done so many more than me, forum letters. Yeah.
So she said, if why not she refers me to Dr. Kong, and Dr. Kong is not media shy. Dr. Kong has been very open in the media, and she has done some work with Dr. Kong before as well, and so that was how I got referred to Dr. Kong, and therefore this year on May 31st. My episode was with Dr. Kong, and it was the TFG perspective for World No Tobacco Day.
Yeah.
Yeah. And I do all these snippets because it's such a long format kind of podcast, right? So I cut all these key ideas on TikTok. And TikTok, is where really you can sense what the ground is, the sentiments on the ground. Because you have all kinds of comments that come in from different people,
The people is mostly the younger ones, I guess, right?
I think there is a shift in TikTok as well. So there are increasingly now also a lot of young adults and even middle-aged adults, on TikTok.
Right.
Because
so what, 30s, 40s also?
Yeah, because so on TikTok, I can actually see the analytics of who are my followers. So I'm able to see the age bands. And the other thing is, I try and check out everyone who follows me, their profile. So sometimes you can really start to see on their profile picture, of family man or of 50-year-old, 60-year-old.
Right.
Yeah, so there are now more people on TikTok who are not just your 12 to 24-year-old or, all these very young adults or teenagers on TikTok.
Mm-hmm.
And I was telling you that so for a video to go viral on TikTok, typically it needs to be usually like either informative or it's either entertaining, right? And for Dr. Kong's on the TFG, Dr. Kong, I wasn't expecting the videos to do well at all. I was thinking, oh my god, Dr. Kong, like a medical doctor talking about smoking control. But surprisingly, the videos did like 750,000 views, 750K, and it's counting. I'm pretty sure that maybe by next year it will do like cumulatively 1 million views, and there are a lot of comments that have come in, and many people have shared their stories with tobacco control, with tobacco as well. Families who have lost loved ones to lung cancer, and families who have been very frustrated with another family member who is a smoker. And also, smokers who have come in themselves to say that, I started smoking at what age? I wish I didn't start. And I hope that people who's reading this can, there are these kind of comments that I felt that there is a broader interest in society, in Singapore society, on this topic of smoking generally.
Yeah.
And also tobacco control. Because many of us are affected by it. Yeah, and that's why today I'm very happy to have you here to just bring on. To me, the TFG perspective is very clear, and it's very specific as well. So today I'm very happy to hear from you your perspective on your work, your expertise in tobacco control. And yeah, so we are rolling and we'll just continue.
Yeah, sure.
So if I can just get you to introduce yourself to the audience, like what do you do and who are you?
Okay, so my name is Yvette van der Eijk. I'm an assistant professor in the NUS Swee Hock School of Public Health. So my research is mostly on tobacco control. So I work quite closely with Ministry of Health, Health Promotion Board, in supporting their tobacco control initiatives. And also in trying to identify what needs to be done next in Singapore, right? As a part of tackling this ongoing problem.
Okay, so how does it work? Are you a civil servant?
No, I work for NUS. I'm an academic.
Okay.
I'm independent, yes.
Oh, okay. But so what the government would do is the government would they like commission you guys to give a report or to give your perspective on tobacco control?
Sometimes yes, but then we also do our own independent work and in identifying what needs to be done next. So for instance, the work that we've been doing on secondhand smoke issue in public housing here, that's something that we're working on ourselves.
And from there, like, so are there also people like you who are working in MOH? Someone like your role in MOH who is working specifically on tobacco control?
There are some folks, but usually they have a bit of a broader
scope.
Yeah, broader scope.
Okay, okay. What got you interested in this topic, as your area of academia?
Sorry, again?
What got you interested in to do tobacco control?
What got me
policies?
interested? Yeah, so I guess I started out in my PhD, I was doing research on addiction and mental health. And then when I started looking more at tobacco as an addiction, it's actually quite striking just how addictive tobacco is and just how extensive the problem is, how many people are really affected by it. Yeah, and I think it's one of those issues that really affects pretty much everybody in some kind of way. I mean, if you're not a smoker, then chances are you know someone who is, or you're exposed to secondhand smoke, still, even in places like here where it's very heavily regulated. So, yeah, I think it's just one of those issues. And also it's a very complex topic, right? It always invites a lot of polarizing opinions.
It does, yeah.
Yeah, so in my research, I like to sort of sort through all of that and try and figure out, okay, what is the way forward in spite of all these complexities?
Okay.
Yeah.
Talking about how addictive tobacco is, right? One of the things that I see in the comments is that there are people who say that it's so addictive, it's so difficult to quit. They have tried so many times, but they have failed to quit smoking. On the other hand, we have also seen people who seemingly are able to just quit. So is it a thing of willpower or is it more of environment? Like what's your perspective on how addictive tobacco is and how can people quit really?
Well, there's no straightforward answer to that because, again, it's a huge spectrum, right? And there's different things at play. So, for instance, you've got some people who are very heavily addicted and it could be for multiple reasons, like they've been smoking for a long time. Maybe they're just somehow vulnerable to addiction more than others. It's also down to how old you were when you started. So generally, the younger you are, the more likely you are to get addicted. There's genetics at play. And it's also
genetics at play as well.
Yeah, and it's also down to the environment quite a lot too. For instance, say if you're in a kind of circumstance where you're not getting much social support, you have a lot of stress going on, a lot of things difficult in your life, then you're more likely to turn to smoking as a crutch and then have that addiction, right? Or it may be harder to quit. Also, if you're lacking things like social support. Yeah, so there are different things. And I think also how addicted you are can change from one point in your life to another, right?
Yes.
Because obviously you've got, young people when they first start smoking, they're kind of slipping into addiction, right? And for some, that process takes a bit longer than others. And I do believe, your environment has a lot to do with it, I think.
So from my own perspective, right, I've seen my friends and my family members who have managed to quit smoking. I have my grandfather was a heavy smoker for many years, and he quit completely after he went through a heart bypass. So there was this health scare, right, and he managed to quit. My best friend, who's a smoker for many years, he managed to quit after he had a bypass as well. So I get this feeling that people are actually quite able to quit, but they don't. They just feel like you are, it's such a long-term health impact thing, right? And until you really get that real health scare, there's actually, you just feel like, okay, you just go day by day, you smoke one cigarette after another, and you don't really have the incentive to quit until you have a health scare. And I've also seen people who have quit after they start their families and have children, and they quit for their children because they don't want an environment whereby their children are exposed to secondhand smoke as well. So this topic on whether it's easy to quit Or is it like, do we need more regulations to help smokers to make the barrier to smoke higher, right? Like, so what are your thoughts on the current regulations in Singapore to bring down the smoking population?
I think in terms of looking for motivators to quit, I think it's kind of a two parts to it, right? So, I mean, yeah, we can have policies and certain things that will motivate smokers to quit. Like what you mentioned, okay, the health scares is one thing, but there are many different motivations why smokers will quit, right? One could be just inconvenience, right? So for instance, New Zealand, part of their tobacco endgame plan to get rid of smoking by 2025 is to reduce the volume of retailers, right? So for instance, if you're living, say if they were to do the equivalent in Singapore, you might have to go to another neighborhood, to a supermarket to get your cigarettes rather than just going down the street. So that inconvenience is a huge thing, right? For some, that will be enough of a motivation. For others, it's family pressure, because perhaps they've had some health issue or whatever. For others, it is something like what you mentioned, having a heart bypass and having that scare. Because I think a lot of us, we tend to underestimate our own personal risk for these things, right? We say, 1 in 2 die, but I'm not going to be in the 1 in 2. I am feel fine. And then they get this health issue, and then that motivation is very close to you personally, right? So that's one thing. But then I think also on top of that, because smoking is so addictive, we do need to have some support for smokers to help them quit, right? So giving them better access to things like nicotine replacement therapy or medication and counseling support, all of that needs to come hand in hand with that.
Are we doing enough in that aspect?
I don't think so, no. Because currently in Singapore, nicotine replacement therapy, like nicotine patches and that is not subsidized. And many people don't seem to engage in quit services too, which is a bit of a problem. Yeah.
Yeah, I mean, I've done I saw some, like on MOH, there's this quit smoking campaign and all. But it really almost feels like it's there because it's there and there really isn't any very serious willpower from the policy point of view to help more people quit smoking. I think it seems to me like the regulators, the government, is quite happy to cite the falling smoking population as success in the quit smoking or the reduction of smokers, kind of where we have progressed in Singapore.
Right.
But there isn't really, and people always say that, it's such a cash cow for the government, the taxes that they collect comes into the billion, the sin tax and all. And people start to question whether the government is really, are they really, is it really in their interest to stamp out smoking? Or are they quite comfortable at where we are right now in terms of our smoking population? And therefore, they are happy to let the status quo just continue as per what it is now.
Yeah, I mean, they shouldn't be because when you look at, even if we're getting tax revenue, right, from tobacco taxes and whatnot, that still doesn't come close to making up for the healthcare costs and also losses in productivity, right? Because remember that smokers get sick more. They tend to take more sick days off work, tend to be less productive at work. So that's a huge cost to the societies as well. And I think in the US, they did some studies and something like a pack of cigarettes would have to cost somewhere close to $50 to make up for those healthcare costs and other costs to society. So, so there's that. So, I do think more needs to be done about that. And, you're right, with the quit campaigns, I mean, it's there, and the resources are there. It's just that I guess there's a cost barrier for many smokers still. And also remembering that generally, smokers are more likely to also be on a lower income than average. So that cost barrier is, I think, something that needs to be looked at. Yeah, and also trying to understand the reasons why they don't really engage in current quit services, because it does seem that most people that smoke, if they've made a quit attempt, it's usually cold turkey, right, based on willpower alone or just getting support from their loved ones. But that's not really enough to curb an addiction. I mean, it is addictive, right? I mean, when you look at the addictiveness of cigarettes compared to other drugs, including illegal drugs, it's right up there with crack, cocaine, and heroin. It is really addictive. And we wouldn't expect a crack addict to just quit cold turkey, right? Right? We would try and support them in some ways. So it's the same with smoking.
Yeah, in Singapore, we do a lot to help drug abusers quit their drug abuse.
Right.
Like there are the halfway houses and there's like the DRC and all. So there's really this topic on vaping. So for people who are trying to quit smoking and they instead turn to vaping,
right,
as what they feel is a step down from cigarettes, Is that fair?
Well, in general, the harm reductive approach is something that we've been embracing in public health for a long time, not just with tobacco, but with, things like opioid addiction. We've got things like needle exchange programs and methadone, which is used to wean opioid addicts off heroin and these kind of hard drugs. So, I think in general, the harm reductive approach is something that is worth considering. But then it has to be properly evaluated, and we have to also make sure that it is in fact reducing harm, right? So this is one challenge that we've seen with e-cigarettes or vaping right now, is that, the question of whether it is really reducing harm is really still out there, and we have to consider the wider societal impacts that it has. Because, for instance, in theory, if we were to switch all smokers onto vaping, right, without getting new people into vaping, that would be a benefit to public health, because it is, in my opinion, I think generally we would agree that vaping is safer than smoking, right? So long as the person quits smoking completely. But what we're seeing in the real world is that a lot of people that vape, like smokers that vape, they're still smoking cigarettes. They're just cutting down, or they're using vaping as a way to get nicotine in places where they can't usually smoke, right? So that's one issue. And then another issue is that the young people are picking it up. People that wouldn't otherwise smoke or be using any kind of nicotine products. So that's a huge kind of collateral damage that a lot of countries are right now having to deal with.
And vaping is so convenient,
Right, it's very easy to disguise.
Yeah, and it's so many people who are just like, I think they're vaping a lot more than they're smoking.
Yeah, because, we still don't really know exactly how much nicotine is in these e-liquids. Most e-liquids do contain nicotine, but how much really can vary. Okay. And in some cases, yes, they do contain nicotine at higher levels than we would find in cigarettes. So they're getting a lot more nicotine, and then their brains is getting addicted much faster.
So vaping is currently banned in Singapore.
Yes.
From your perspective, is it better for us to regulate vapes instead of an outright ban?
What do you mean by regulate exactly?
So that means there are so many different brands, right, of vapes and vape pods and all. So all this, so it's like food, right? There's SFA, the Singapore Food Agency, that does all these tests on whether there are preservatives and additives in food. And if the food item doesn't meet certain health standards, they are then recalled or they are banned from sale in the public.
Right.
And so from vaping, what I see is that there are so many different brands and so many different pods that people can buy, and people do not really understand like which are the ones that are really harmful. And so in regulating, my idea of regulating vape would be maybe you have 2 or 3 brands that are approved for sale in Singapore, and you have a certain age limit, minimum age where people can vape. And you have all these retailers that can then, authorized retailers, that can then sell all these authorized vapes. And that would be my very simple idea of regulation.
So something like what we have for tobacco, basically.
Exactly, yeah.
Yeah. I think for that, honestly the optimal way would be, because if you think about it, the goal of vapes is not to have young people use them. Like say if young people are looking for some kind of novelty, not for them to then pick up vaping instead of smoking, right? We don't want young people to be using it. The main goal is to make sure that smokers have some kind of have a better quit alternative.
Okay.
That's what we want. Not even cutting down, because honestly, cutting down smoking does not benefit your health. If you're going to have the benefits, you have to quit completely. So the goal would be to get smokers to quit completely using vapes, right? So, an optimal approach would be something like a prescription system, right? Whereby smokers could get the vapes from a doctor, and then the doctor would explain to them, the risks and the side effects and all of that, like what we do with medication, right?
Okay.
That would be the optimal way. And there's actually a route for the companies to do that in Singapore. Then they would have to go down the medicinal route and get licenses. But none of them have pursued this because it's unlikely that the vapes would pass their safety and efficacy test.
Yeah, because when you travel to Malaysia, for example, and you go into a vape shop, it's almost like a candy store, right?
Yes.
And there are so many brands, so many flavors, so many different products that you can choose from, and the health aspect of it, like how dangerous they are in terms of their content. I think it's I personally am of the view that it's better for us to regulate than to outright ban. Because if someone is, I mean, there are many vapors in Singapore today, but if they're getting access to so-called the healthier products, the healthier vaping product, I think it's better than them just buying something off the internet, off a Telegram group chat, or just going into Malaysia to buy all these vape pods that you do not know what the contents are.
Right.
Yeah, I'm sure there are differences in the quality of the vape vape
really.
pods. That's not really.
Well, there's countries where they have a system like what you've described, right? Where there's a legal market for vaping or vapes, but it's kind of regulated. Like there's a minimum legal age, you're not allowed to vape in public places. Same as with the smoking ban, right? So there are countries like that. But they've actually got higher rates of youth vaping than we would observe in Singapore. So I think in Singapore, the fact that we have the ban, I mean, it has not gotten rid of vaping completely, as we know.
Yeah.
But it has, I think, reduced it. I think it has reduced it more than it would be if, say, we would have allowed a system like what you described. And I think we would have much higher youth vaping rates here.
Okay. I want to come back to the barriers to smoking, right?
Mm-hmm.
There's something that I read about one of your ideas, which is certainly very unpopular among smokers, is your study on taxes, right? If we compare how cigarette prices have risen in relation to inflation, actually cigarettes are actually not that expensive per se.
Yeah, because if inflation pushes prices up, but tobacco taxes, tobacco prices remain the same, and they become more affordable over time, relatively speaking.
So for you, do you feel that from a public policy point of view, the cost of cigarettes is going to be, because you mentioned a lot of smokers typically are from the low income group. And so do you feel like if we really push up, like if we have a drastic increase in the smoking taxes, like if we charge like $30, let's say we have a 100% increase, right? $30 per pack,
Okay.
Will it really bring down, because people are unable to afford smoking and smoking becomes like a luxury?
Well, generally what we see with taxes in general is that, the more you increase the tax, the more we see smoking rates go down.
Mm.
So there will be that group of people who quit or drastically cut down with the view of quitting, say. And of course, people range in how price sensitive they are, right? So
Yep.
People on a lower income, young people who don't have as much income either, they tend to be more sensitive to taxes.
Mm. Is that a preferred way to control tobacco in society?
Well, the thing is, tobacco policy, it's not one single approach that we use as a magic bullet. It's usually a combination of measures that work together, and tax is part of that picture.
Okay. Dr. Yvette, so what are you working on right now in your daily work? Like, what's your scope of study, or what's your...
Well, one issue that we've been working on quite a lot is flavored cigarettes. Looking at that as an issue in Singapore. And we've been studying flavored cigarette use among the young people here. Yeah, to try and understand why flavored cigarettes are so popular here in Singapore.
I read that in the US, the use of flavored cigarettes is a lot lower than in Singapore. So flavored cigarettes, we're talking about products like menthol,
fruit-flavored cigarettes. So the kind of flavors we've come across on the market here is things like grape and berry and menthol and lemon and all
and
these.
typically menthol, right?
Menthol is the most common
It's the
one.
most common one.
Yeah, around half the cigarettes sold in Singapore are menthol flavored.
Yeah. So are there countries that have completely banned flavored cigarettes?
There are a few, actually quite a few now. Canada banned it, I think in 2010s, at least 5 years ago. European Union banned it a couple of years back. So that's the entire European Union, including the UK as well, and a few African countries. And then there's partial flavor bans where, like for instance, in the US, there are some localities that have banned all flavored cigarettes, including menthols.
Okay. So it sounds very doable, right, in Singapore's context as well?
I think it is, yeah.
Okay.
It would be doable. And I think it's one measure that would have a real drastic impact, especially on youth smoking, because what we know about these flavors is that really the tobacco companies use them to target young people, especially in places like Singapore, where they don't have, they can't really advertise their products here anymore, right? They can't advertise on billboards. They can't promote at point of sale because all those displays are banned. They can't use the packaging anymore because we have plain packaging. So there's not many ways for the companies to make their products appealing to young people. So they look at the product design itself, especially flavors. So, yeah.
Is there a projection in your studies, like if Singapore is to ban flavored cigarettes, like how would that impact the smoking population?
Yeah, it would have a huge impact. And we've done a simulation study on this. We found that among young adults, it would eventually cut the smoking rates by a third. Yeah, among the young adults, so like 18 to 29-year-olds. Simply because flavored cigarette use is so common among this group.
Okay.
Yeah.
And so are they more addictive or are they equally addictive?
They're actually more addictive
More
in a way
addictive,
because menthol flavor especially, because what we know is that menthol interacts with nicotine in the brain, making it more addictive, its overall effect.
So you get a better sensation from smoking that.
Yeah, and also it kind of masks that harshness, which is a big thing with the young people, because when they first try cigarette, if it's not a flavored one, it tastes really harsh and horrible.
Yeah.
And they're less likely to then continue with it. Whereas if it's got menthol in it, it masks that irritation. Yeah. And then that's why the young people that start with menthols, they're more likely to become addicted smokers.
Okay. Earlier before we started, I was talking about, if I'm the king of Singapore tomorrow, like what will I do to tobacco control? If you're the king of Singapore tomorrow,
Queen.
Actually, what would you do for tobacco control? What
wouldn't I do? No, I think the single policy that would have the biggest overnight impact really would be the flavored cigarettes ban.
So that's the single most.
Well, of course, just banning it outright.
Other than an outright ban.
Other than an outright ban, yeah, I think that's a policy that would have a massive impact.
Okay.
Another one that has actually been researched overseas quite a bit, and New Zealand's going ahead with this, it seems, is having very low nicotine cigarettes. So this would basically strip most of the nicotine from cigarettes. So most cigarettes now have about 10 to 15 milligram per gram of nicotine in them. So this would reduce it down to 0.4 milligram per gram. So that's more than a 95% reduction in the amount of nicotine per cigarette. Yeah. So New Zealand has announced that it will be doing this as part of its tobacco-free action plan for 2025, right? Okay. So this is the first country that is really committed to this policy. And it's actually been quite well researched, right? Because when I first heard about it, I was a bit skeptical because I thought, okay, if the cigarettes have 95% less nicotine, surely the smokers are then going to up their consumption to like 100 a day to get that nicotine in. But they've actually done a few randomized clinical trials with current smokers, including those who have no interest in quitting, right? And then it was like a double-blind system. So some, they kept their usual cigarettes, whereas others were then given this very low nicotine cigarette to switch to. And what they found is that actually they didn't really increase their number of cigarettes, and it became easier for them to wean off smoking, and they didn't have any adverse withdrawal effects or anything like that. So, yeah, it was actually quite successful in that sense. So that data has been very encouraging, and there's been a few large studies of this kind looking at this. So
it sounds very logical to me, though.
Yeah, I mean, that's another policy that I'd
it's
probably
like how we are
for.
reducing sugar in our canned drinks, or
right.
And you have that healthier sign.
Right, I mean, you just get used to the less sugar, right? And yeah.
Exactly. And I think a lot of smokers, right, it's become like a habit and a lifestyle for them. Like after every meal, they must go have a smoke, and they must have a cigarette. If it's a lower nicotine one, then they continue with the habit, but they have a. But are the tobacco companies willing to produce? So they have no choice but to produce such products, because in order to sell in their country, so we will have the tobacco companies coming up with a different product that's low in nicotine content.
Well, actually, to produce these is fairly easy because right now, anyway, the tobacco companies, they genetically modify the tobacco plants to produce more nicotine. So we just have to get them to use genetically modified species that don't produce any nicotine. Simple as that. Or there's other stages of the production process where nicotine can be removed out. Yeah. So we'll just be having to, basically regulate them into it. I mean, they're not going to voluntarily do it, of course. They would have to be regulated.
So talking about regulations, right? I believe that any impactful and meaningful tobacco control policies has to come in the form of legislation. Because if I draw parallel to like drugs usage in Singapore, right? Like even something that is as hardly crushed down and as highly regulated as drugs, we still have drug abusers in Singapore. We are not a drug-free society. And the government and the ministries, they have constantly come out to tell people that the war against drug is a constant one, that as a society, we have to always take this very hard approach against drugs.
Yep.
And how would people then be able to quit smoking that, like you mentioned, is as addictive as all these drugs if it's not because of regulations? Just depending on willpower and all, I think it's very difficult. So, legislation, do you think there is, where should we be heading as a society, for legislation? Because there's also this balance between human rights, individual choices, and protecting the population and coming to healthcare costs. Where do you think we should be heading as a society in terms of legislation?
Yeah, I mean, in a way, we're already on that journey quite a lot. I mean, you mentioned about rights and individual choice, but we also have to factor in those rights of the non-smokers who are exposed to secondhand smoke, and the young people who are maybe being lured into picking this up, who are being sort of manipulated by the advertising of the tobacco companies, right? And I think the tobacco industry is another huge factor that we've increasingly recognized. They just need to be regulated because their goals are completely at odds with the goals of public health and the societal greater good, right? I mean, their goal is to just sell cigarettes, and there's no benefit that we can reap from cigarettes whatsoever. So the more we regulate them, the better it is going to be for public health.
Is there so-called a tobacco industry in Singapore?
There is. I mean, yeah, of course. They are still selling cigarettes here.
Yeah, okay.
The major transnationals are all operating here. And in fact, they all have headquarters here as well.
Okay, but they aren't able to lobby for
Well, they do have rules against that here in Singapore. And I think generally the climate is quite anti-tobacco.
Yep.
Although we do know that they still lobby, but it's a bit more quiet. I mean, they're not going to go standing outside government buildings with placards, It's not like in US, for instance, that kind of overt lobbying and protest. But we do know that they're still very much involved with building relationships with who they perceive as influential people. And I think also the fact that they all have their headquarters here is quite telling. In that sense, I mean, like Japan Tobacco, British American Tobacco, Philip Morris, and even Juul, the e-cigarette manufacturer, they all have headquarters here in Singapore.
So if you're the queen, will you chase them all out?
Oh, totally.
Okay.
Yeah.
So they shouldn't be able to have their headquarters in Singapore and conduct their business in Singapore?
I think that's at odds with the goal. I mean, the government has generally been very anti-tobacco. And I think especially on e-cigarettes, the stance in Singapore is that we don't allow these products to be sold at all. They're illegal here. So then why do we have a headquarter for Juul? It would be a bit like having a marijuana plant when we have a very strong anti-marijuana stance. It's just kind of at odds, right? It sends a mixed message, I think.
Okay, understand. Coming on the healthcare burden of smoking, right? Because today, if you are to purchase an insurance policy in Singapore, for many of these life insurance policies, there's actually a differential premium for a smoker and a non-smoker. So as a smoker, you actually pay a higher rate for insurance policy. But in our healthcare system today, we actually do not differentiate between smokers and non-smokers. So the smokers pay a same MediShield Life premium, for example, as a non-smoker. And when you're warded, right, the room and board charges do not penalize a smoker as well. Is there, from a policy point of view, is there something that it's only fair enough to non-smokers to look into, whether smokers should pay a higher share in healthcare costs, expenditures in Singapore?
Yeah, that's a tricky one and quite a polarizing issue as well. I mean, me personally, when I'm thinking about overall what kind of approach to take against this whole tobacco issue, when we look at it more holistically, I don't think the focus should be on punishing smokers, because we have to remember that most of them started smoking at a fairly young age before they could really appreciate those health effects, and then they would have become addicted in a fairly short time. And then at the same time, much of it is, just being lured into it by things like the tobacco industry's advertising and the way that they manipulate the products and the kind of messages that they send out to society. So I don't think it would be fair to just penalize them, into quitting.
Especially on their sick bed.
Right, I do think the approach needs to just be more holistic than that.
Okay.
I mean, it's something to consider, you know, especially if the healthcare costs just become too overwhelming. But I think another and probably more efficient system would be, you know, the tobacco taxes would be to earmark that funding and put that back into things like healthcare.
Okay.
And, you know, compensating for the damage caused
So
by
in that
smoking.
sense, they pay their fair share as well.
Well, they're not making up for it, but they're at least chipping in towards it. I think that would be a more efficient system. And some countries are already doing that. Like, I know that in Philippines, they had their sin tax, which covers, I think, alcohol, tobacco, some other vice products. And they were using that to fund healthcare for the underserved.
Okay. And then it's interesting for me to hear from you earlier that the minimum age actually doesn't do very much to help bring down smoking prevalence.
Well, it's part of the picture, you know, it helps. And it does help to send that message, you know. I mean, for example, if you have a minimum age 16, that's going to be, you know, not as effective as 21. But it's certainly not going to be a magic bullet. I do think that, you know, something like, you know, tobacco-free generation would be much more effective at bringing down smoking than, say, MLA 21 or higher.
Hey, do you write about bringing the minimum age law to 25?
Yes.
Okay, so
That was just
why
more
25?
Because the thing is, when we look at how the brain develops, right, there are certain regions that are involved in controlling your behavior, like self-control. So those regions are quite important with addiction, right? And that's also a region that gets damaged in addiction. So for instance, and that's also a region that's developing up until age 25. It's not fully developed until then. So say if someone starts to smoke in their teens, right, then, you know, the damage that's caused by the cigarette use and then by the addiction, it damages that part of the brain, so it never gets a chance to really properly develop. Yeah. So the theory goes that, okay, if people were to only be able to smoke after age 25, their chances of getting addiction would be less. Yeah.
I was actually very happy when the minimum age went up to 21 because as a Singaporean boy, I have seen for myself friends who have picked up smoking in army. And we are in army at the age of like 19, 20, some a bit later. So after 21, you are still in camp, like doing your active service, your 2 years of active service.
Yeah.
So I do think that if the minimum age can be brought up just like to 23, then most of the people who are in army in service would not be able to then pick up the habit.
Yeah, I mean, it helps. And in the context, if many people are picking it up in those years because of
peer pressure and environment.
Yeah, and they aren't being in the army and all that, then that's certainly going to help. Yeah. But I don't think it's going to be the one policy that gets rid of smoking in Singapore.
Okay. Just now you mentioned that there are better policies that can, better. Have we already discussed them?
You mean endgame approaches?
What do you think of the endgame approach?
Well, the endgame, first of all, the endgame is not really an approach, it's a goal. So the tobacco endgame is the goal to basically get rid of smoking by a certain year.
Oh, okay.
Right? So whereas now the focus has been on tobacco control, which is bringing down smoking rates, right? But not necessarily to a certain point, whereas tobacco endgame is to effectively get rid of it.
Okay.
Yeah. So the idea goes that this will require a more novel approach above what's already being done, because the policies that we have now kind of slowly bring it down, right? Whereas this is something more novel. So for instance, New Zealand is one country that is committed to that. So New Zealand, they're doing tobacco-free generation, where they ban cigarette sales to people born after a certain year. So that is the tobacco endgame, right? Because it does actually get rid of smoking. It takes a long time, but it does get rid of it. Another would be the one that we discussed earlier about taking the nicotine out of cigarettes. Yep. That's considered an endgame policy because it's probably more aggressive, right, than current measures. And because, if there's no nicotine in cigarettes, the young people at start, we would not expect them to continue smoking because there's no incentive, right, if there's no nicotine.
This TFG approach, right, do you think that is the best approach to reach an end game, even though it takes like maybe 40 years or 50 years?
Yeah, I was going to say it depends on the goal, because if you have, say you want to be a tobacco-free country by 2030, you're not going to achieve that with tobacco-free generation alone.
Yep.
Yeah, because it does take about 40 years to get to that 5%, that very low smoking prevalence where it's more or less obsolete in society. But I think what is very powerful about tobacco-free generation is the message that it sends to society, Because, when New Zealand first announced that it was going tobacco-free, or that it was doing this whole tobacco-free generation, it's basically saying that, smoking is not acceptable at any age, regardless of whether you're 20 or 100 years old. We don't want to tolerate this, and we want to get rid of this. So I think it's the message. So it's what we call a very good way to denormalize tobacco and the tobacco business as a whole.
Okay. Is New Zealand at the forefront of tobacco control from the government, public health point of view?
Definitely, because really, there are a number of countries now that have committed to this tobacco endgame, where they've said, okay, we want to be tobacco-free by a certain year.
Who are these countries?
So off the top of my head, well, New Zealand, we know.
Is
Canada.
Denmark one of them?
No, but they are talking about having a tobacco-free generation.
Okay.
Denmark. Netherlands as well.
Okay.
And the tobacco endgame countries, let's see, UK, Canada, Finland, New Zealand. There's a handful of others, but at the top of my head, those are the ones, that I remember.
Okay, because especially in the Asian context, like smoking is still very prevalent.
Right.
And especially in the ASEAN countries as well.
Yeah.
Indonesia and
Indonesia is terrible.
Yeah, it's terrible, right?
Yeah.
And they have so much youth smoking. Young children who start smoking at the age of
2.
Yeah, exactly. And parents, what's interesting is parents are so seemingly proud of like their kid being able to smoke like a boss, So I always feel that Singapore does try and take more of a wait and see kind of approach in terms of legislation. So if a country like New Zealand is able to really implement this, then the government would then probably be happier or be more willing to look at this approach and study its effectiveness in terms of tobacco control.
Right.
What's the, we one of the topics that you write about is on secondhand smoke, and neighbours. What's your perspective on secondhand smoke?
Yeah, it depends a lot on the place where you're looking at. But I think with Singapore, even though smoking rates are very low here, secondhand smoke is still very much a problem because it's so densely populated where we live. Almost all of us live in high-rise buildings, right? HDBs, condos. And even in public places, right, it's very hard to really avoid people. And even with a smoking prevalence of around 10%, you're inevitably going to encounter people that smoke in public places, in their homes or wherever. And it's going to expose people. Yeah, and we actually did a study recently where we did a survey, which was somewhat nationally representative, right, in terms of social demographics. And we found that around 6% of people smoke in their homes. So not all smokers smoke at home, but around 6% of the population, right? But almost 60% were exposed to secondhand smoke in their home. So that means that for every person that smokes in their home, another 10 neighbors are exposed. Yeah. And if you compare it to countries like, I don't know, say Australia or UK, where most people live in landed properties, it's going to be a slightly different situation.
And therefore it warrants enough damage for us to look at it a lot more seriously from there are MPs who have lobbied for a ban in smoking at home, but it seems like MOH is still quite reluctant to do it.
Yeah.
So do you think the fair and the right thing for us is to just have an outright ban on smoking at home?
I think, yeah, well, it's one of those very touchy issues, right? Which is going to invite a lot of polarizing opinions. But I do think it's something that we need to look at a lot more. Based on the research that we've done so far anyway, we do know that it's having real effects on people, right? Especially the mental health. Because, if you have people that are a non-smoking family, maybe they are living with vulnerable people like an elderly or young children, and then they have this secondhand smoke come into their homes constantly, and they know that the health effects are very real, right? Even small amounts of secondhand smoke can have, very real effects, especially on these kind of vulnerable people or people with health condition, right? So then, of course, they're getting worried about it. They're going to get anxious, and they can't do anything because the neighbor doesn't want to change the behavior. Maybe they've tried to address the situation personally. And really, right now, there's very few remedies for people that are affected by it. I mean, there's no regulation to cover it. Really, they're just relying on the goodwill of their neighbours, right? Which is, well, it can vary.
Or they move out.
Or they move out, but then, I mean, how do you know?
And that's so unfair to them.
Yeah, but then how do you know that you're not going to move into
the next
another
one,
place?
Yeah.
I mean, we in our research, we interviewed some people who had done that, and then they were in another block where people are smoking again. So it's like very hard to escape this issue. Yeah, and not everyone can afford to move out. And then with the 5-year MOPs and the HDBs here, I mean, it's not always that simple, right?
Okay. Is secondhand smoke more dangerous than the smoker actually smoking himself or herself?
It depends on what you look at. I mean, secondhand smoke, we do know that it burns less completely than first-hand smoke. So it does have more chemicals and other nasty stuff in it. So I mean, the health effects are very real, secondhand smoke.
Recently, one of the coffee shops in the neighborhood was renovated. And I was actually quite happy to see that they have completely gotten rid of the smoking area.
Mm-hmm.
So, they used to allocate like just a few tables. Then there's this yellow line that demarcates the smoking tables from the non-smoking tables.
Right.
But we all know that the smoke could just drift through to the non-smoking area, and if you have no choice but to sit in a non-smoking area that's close by to a smoking area, you get the effects of second smoke.
Yeah.
So it seems like there's some companies like this, right, making an effort to also do their part in helping to bring down smoking. So I'm just hoping that more coffee shops can look into getting rid of their smoking tables altogether.
Yeah, because I mean, having this smoking zone, no smoking zone system really doesn't help in any way whatsoever. I mean, we know this through decades experience with the smoking bans in bars and restaurants, right? I mean, they all used to have smoking zones.
Yeah.
And we know that it wasn't benefiting anyone's health. It was normalizing smoking in these places and just wasn't protecting people. And also the experience that we know from then is, I mean, at that time, when countries were proposing to just ban smoking in these places, there was a lot of pushback from the tobacco companies. And they actually made a great effort to have what they called mutual accommodation campaigns, which was this idea that, let's all just try and get along.
Yeah.
Right? But essentially the message that they were sending out is that non-smokers should just tolerate it in the name of social harmony, right? And then smokers should try and be more socially responsible. But in reality, nothing really was happening. Yeah. And the smokers didn't really modify their behavior until there were regulations. Yeah, and I think now there's a real parallel that we're seeing with smoking bans. I mean, when we're discussing regulating smoking in homes, right? Because when you look at the kind of suggestions that have been put forth, by those who aren't in favor of regulation, they're saying, we should encourage smokers to be more socially responsible. But it's like, we're already doing that. People have already tried to approach their neighbors, their smoking neighbors, and try to talk to them and say, look, your smoke is affecting my health. It's going into my home. And they'll just say, well, just close your windows.
Yeah, exactly.
So they're not really... I mean, there are going to be those who do make a genuine effort to work things out with their neighbors. I'm not saying they're all inconsiderate, because there are many that are considerate, and mindful. But then there are also a fair few that are not. And those are the ones who I think we will need to regulate.
Okay. So instead of blanket regulations, we can look at more targeted kind of approach.
Well, the thing is, if
In
you're going to
individual
regulate
cases,
it, will cover everybody.
Cover everybody. Okay. Yeah,
Yeah.
and one of my points was that, if you have a neighbor that smokes, right, it brings tangible economic repercussions as well. If I'm trying to sell my house and someone who comes in to view the property and they smell secondhand smoke drifting into the house, they might not want to buy the house.
Yeah, I know personally I would avoid buying that home.
Exactly, I would personally,
Yeah.
or they might bargain for a lower price.
Right, yeah.
And it affects me as a seller of the house.
Yeah, I think so. And I mean, in this thing, we haven't done much research on this in Singapore context, but I do know that in other countries, like in the United States, they've got more regulations on smoking in public housing there, or there are certain housing boards, where all of their properties have been made completely smoke-free. And one of the major rationales behind that argument was the monetary value, because they're saying, well, homes with smokers in them, or where people have smoked, they have higher maintenance costs, there's a higher fire risk. And also they're harder to sell because people just don't want to live in a place that smells of third-hand smoke or second-hand smoke.
Yep.
Yeah. So they do tend to fetch a lower value, I guess.
Mm.
Yeah, and I do think that, say if you had certain condos where there was a smoke-free policy, or if there were certain HDB blocks with a 100% smoke-free policy, that they would fetch a higher premium.
Yeah.
Yeah.
I mean, it's like going to stay in a hotel, right? If the whole hotel is like, this thing about hotel rooms, right? Like, if someone has smoked in the room before, you go in and you smell that stale cigarette smell, and you know that. And the next time, I probably wouldn't want to like book the hotel again.
No, I'd ask for another room, which is a hassle for the hotel management, right?
So
Yeah.
then, if the whole hotel is non-smoking, and then they might be able to have repeat customers, and they have fetch a high premium for their rooms, right?
Yeah.
I think that's the same for like public housing as well. Yeah, so Singapore is really, there's what I understood from the TikTok videos that I have posted for TFG is that people are generally they really have vested kind of interest in this topic of smoking. Whether is it losing a loved one through lung cancer and all. Coming about this health lung cancer thing, right?
Yeah.
Why are there some people who smoke for many years but they do not get into health issues? And some smokers always say that, my grandmother smoked for 30 years and she lived to 97 and...
Yeah. I mean, there's always going to be...
genetics as well?
Anomalies like this.
Oh, okay. So they're just out of that, the bell curve.
Well, the stats say that, 1 in 2 smokers die young because of tobacco-related disease, whether it be lung cancer or heart disease or respiratory issues or whatever. 1 in 2, and it's likely an underestimate as well. There are other countries where they've estimated it's even more than that. So, 1 in 2 is not everybody. So, of course, it's going to be here and there people that, have no issues at all. Good for them. But I think it's important to stay objective, because we all have anecdotes like this. I personally know people who have died from tobacco-related disease. So there are those kind of personal stories as well. Yeah.
And there are also people who will say that, no one in my family smokes, but who still die of lung cancer. So you don't necessarily... Of course, there will also be people who do not smoke, but they get lung cancers and all.
Yeah.
So, yeah. So to summarize, right? For you really feel that, number one, the ban of flavoured cigarettes would help a lot?
Yeah.
Potentially up to 1/3?
If young adults, yes.
Okay, and also the bringing the minimum age to 25.
No, I think getting rid of nicotine.
Reduction in nicotine. Okay.
Yes.
Okay. So New Zealand has already done it?
They've announced that they're going to do it.
Okay.
As part of their tobacco endgame plan.
Okay, so where was I? The first one was
Flavors ban.
Flavors ban, and the second one is reducing the nicotine content in cigarettes, conventional cigarettes.
Mm-hmm.
Is there a third one?
For Singapore specifically?
For Singapore specifically, yes.
I would say start looking at regulating smoking in housing, because even as smoking rates go down, as I mentioned earlier, right, even with the very low smoking prevalence, people are still going to be exposed to secondhand smoke. And in that interim, we do need to look at solutions for people who are affected by it. So yeah, I think that's one issue that needs to be really a lot higher on the priorities list.
Okay, so there's we are in Yishun today,
Yes.
and nearby in the neighbourhood, Nee Soon South, previously the MP for Nee Soon South, Madam Liu, she came up with this designated smoking points, whereby in the neighbourhood, they built all these little shelters, nicely little shelters that smokers have to then go there to smoke.
Yeah.
Is that something that helps?
I think it can. I mean, again, as I mentioned earlier, people fall on a spectrum, right? People that smoke. I mean, you're going to have those who are very socially conscious, very aware of how the secondhand smoke affects other people, and maybe they've got some pressure by their family members also. So they will be the ones to voluntarily use these designated smoking points, even when it's more inconvenient. But then you have those who really are just, they'll do whatever is most convenient for them, and they're not too fussed, by how their secondhand smoke affects others, or maybe they don't think it has that much of an impact. So they will be the ones who I don't think will use those designated smoking points unless they're being regulated into it.
So the most direct way would be actually just an outright ban in smoking at home, for smoking at home.
Yeah, I mean, I do think it's worth trying softer measures first.
Like?
Well, like what they've done in Nee Soon South, install designated smoking points, perhaps have a public education campaign, you know, to say, okay, like even small amounts of secondhand smoke affect people's health, you know, and also just to make people aware that, for example, you know, if we knew there are certain blocks that are hotspot areas where, you know, there's a lot more complaints or a lot of people with, say, young children or elderlies living there, that people are a bit more aware of, you know, how their secondhand smoke impacts others. And then that might, you know, motivate them to smoke somewhere else. So that kind of approach, you know, where we're not necessarily, you know, regulating or forcing them into it, that is always worth trying first. But honestly, I'm a little skeptical of this because this has been tried, you know, like in the 80s and 90s with public smoking bans, right? And it did not really work.
Yeah, I'm actually fairly skeptical about this educational aspect of educating smokers. Because we have so many smokers, some smokers are, you know, they have been smokers for so many years and they have already seen their rights to smoking become so restricted over the years. And they feel like, what more do you want from me, right? Like, now I can't smoke while I'm walking in sheltered areas. I can't smoke in the corridors. I can't smoke in the void decks, parks, restaurants, like you name it, right? And now even at home, you want me to like not smoke, and I need to like go downstairs for smoke at the designated area. So I don't think education. That's why I always feel like regulation is still what's going to work.
Right. Yeah. And I mean, historically, you know, knowing just the experience of other countries and also Singapore, really, where they have banned smoking in other places. I think, you know, these voluntary kind of measures, I mean, it will work for some, but I don't think it's going to really eliminate the issue or really significantly bring it down. And, you know, especially it depends, right? Like, for example, in certain buildings that are maybe hotspots where there's more smokers and things like that. So I think really most effective approach would be something like regulation. Yeah. And I do think that we need to move more towards a paradigm, not like where can't you smoke, but where can you smoke? In a city like this, where it's so densely populated and, you know, inevitably you're going to run into it, I think that needs to be the new kind of paradigm.
Yeah, actually, I think it's very doable. So a lot of companies, like let's say when they have their own building, they have that, I mean, they have a smoking point. Or even in camps as well, in army camps, we have the yellow boxes, you know. Yeah. So it's a more of like where you can smoke.
Right.
And not where can't you smoke.
Right.
Yeah. Okay, I think we have covered a lot. Is there anything else that, you know, you are working on that you can share with me in terms of your work? Or over the years, your proudest, like what's been the most defining research that you have done on tobacco control policy?
I would say the most interesting research we've done is on the tobacco industry tactics. Yeah, because there's this gigantic resource of internal industry documents, which has been made available through lawsuits against the tobacco companies, right? And they're actually legally required to release their internal documents online every month.
Every month?
Yeah, because there was this massive lawsuit in the United States where the United States basically sued the major tobacco companies for basically targeting youth, and they're basically holding them responsible for the tobacco problem, right? And then all these documents were released as part of that lawsuit and still ongoing. Yeah. So, I mean, right now there's about 14 million internal industry documents that we can go through. And we've been looking at the ones for Singapore as well, the tobacco companies, the transnationals that were operating in Singapore. And we've learned quite a great deal, you know, on how they target young people here and just how they operate in general. And, you know, it's really telling just how deliberately they were targeting, say, 15-year-olds here with flavored cigarettes and with light cigarettes because they knew they were health conscious. So it's like, oh, you know, let's keep them in the market longer. Let's discourage them from quitting by selling them light cigarettes, even though they knew from their own data that these light cigarettes aren't actually safer than regular cigarettes. So that kind of level of deception, you know, and like very systematic targeting of vulnerable people, like young people, that was very fascinating research to do.
And it's so subtle in the background that we do not even realize that.
Yeah, and actually, you know, some of the arguments that you've mentioned, like on smokers' rights, that was arguments that were actually seeded by the tobacco companies. And then they astroturf it, which means they will put up these grassroots organizations. They're not actually grassroots. They're actually set up and funded by tobacco companies like smokers' rights groups. And then they get them to front these kind of arguments and make it look like there's a huge movement of smokers that are advocating for their personal rights. And then, of course, that argument then it becomes internalized. So a lot of this, rhetoric is really industry created, which is fascinating the more you read up about it. And I think the influence that they've had really goes a lot deeper than we appreciate.
I suddenly feel so used and gullible. No, because and also it's evident from the TikTok comments that a lot of people take a very, like we mentioned earlier, there's too much control, and where do we put a stop to it? And it's a slippery slope, right?
Right.
Like today you are going after tobacco, tomorrow is it alcohol, then the day after tomorrow is it like McDonald's and fast food?
Yeah, well, remember the slippery slope argument is not a very strong argument, because generally there's big differences between the products that we're talking about, right? Tobacco is very different to sugar, is very different to marijuana, is very different to fast food. So the regulatory approach that we take will be different. Because, for instance, tobacco is, cigarettes especially, are very uniquely addictive. So that's one thing that we have to bear in mind. Sugar is addictive too, but not to the same extent as tobacco.
Yeah, I also tell people that it's actually not very easy to be addicted to alcohol as well.
I wouldn't say it's not easy, but it's certainly less addictive than cigarettes. Because remember, alcohol, we drink it. So by the time it goes through the stomach, and it takes a while to get into the brain, right? Whereas with cigarettes, you shoot it into your lungs and it hits your brain within a few seconds. And then also the tobacco companies actually engineer cigarettes to be addictive. So, for instance, they put additives in like ammonia, which freebases the nicotine, means it makes it more bioavailable, so that when it hits your brain, it hits it faster. Yeah. So they engineer it in that kind of way. So that makes it, say, more addictive than alcohol and, other products.
So one of the things that I couldn't really understand, I didn't fully appreciate, but today I have a better appreciation of, is Dr. Kong. He kept mentioning about the evil tobacco industry. And to me, I'm like, is there really a tobacco industry in Singapore? Because there's already no advertisement. They can't show their products in the open. Retailers have to cover up their, the display of cigarettes and all. So where is that tobacco industry that we are talking about? But behind, so there are actually very, very strong forces at work.
Yes, definitely. We just don't see it as much because, they can't. For instance, there are certain rules about them engaging with government officials, so they can't do that directly. They can't advertise their products on billboards here, but they're still going to go about it in ways that they can still do it, right? So, for instance, we know that they can no longer advertise or promote at point of sale and things like that. So what we're seeing nowadays is a lot more promotion on social media. There was a big study done a few years back from an NGO called Tobacco Free Kids, Campaign for Tobacco Free Kids. And what they found is, that the tobacco companies have been paying influencers to promote cigarette products. And often, they'll give them very specific instructions like, don't make it look like an advert, and, cover up the health warning with your fingers so that it doesn't show on the picture, this kind of thing. So we know that social media is like a huge way for them to promote. And of course, social media is cross-border, so it's very hard to prevent that from other countries. We know with vaping, this is happening quite a lot as well. And as far as lobbying goes, as I mentioned, they're going to go behind the scenes. If lobbying is not accepted, then they will perhaps work through individuals or, they will not go directly. And we also know that tobacco companies tend to use front groups and third parties quite a lot. So, for instance, one common tactic is they will actually fund researchers to do their studies, and then these studies will say things like, vaping is safe, or, make industry-friendly conclusions. So this is happening a lot with vaping as well, actually.
Okay. So they know that the earlier a person picks up smoking, the more likely they are to be addicted for life.
Yes.
Which will translate to higher lifetime revenue for them.
More loyal clients.
So although they know that the minimum age is, let's say, 21, but behind the scenes, they are still talking about how do we actively target the 15-year-old, the 16-year-old to pick up smoking?
Well, we know that now they're not going to talk about it quite so directly.
Okay.
Because as I mentioned, that lawsuit where all these internal documents were released online. So since then, they've been better at not keeping a paper trail for things, and they've been much more, sensitive to what they say in their own documents. So, of course, the evidence for that is harder to find. But we do know that young people are still their main target, because when you look at the way they advertise their products, when you look at vaping, for instance, some of the ads that were put out on social media, if you just look at some of the ad campaigns for some of these brands, it's all like they're showing young people, lots of bright colors.
Yep.
Even for like Marlboro cigarettes, you look at some of the ad campaigns for that, it's all these young influencers, in their early 20s who the teenagers are going to look up to. So it's quite clear who their target audience is.
Okay, and it's really contradictory that Singapore as a country is allowing all these operations to be in Singapore.
Yeah, I think it is. Yeah.
Okay. Do you have anything else you want to add?
No, I think we covered a lot.
Okay. Maybe I can just ask some curious questions about you in Singapore.
Yeah, sure.
Like how long have you been in Singapore? And
about 12 years on and off. So I came here initially to do my PhD in 2011.
Okay, and you're from the Netherlands.
Yeah, correct.
Okay, and you did your PhD in Singapore. Like, what brought you to Singapore actually?
Well, I was backpacking
Oh,
through
okay.
Southeast Asia, and I decided, okay, it's maybe a good time to get back into education. So I came here to do my PhD.
Okay. So was your backpack a lot focused on Asia and like Southeast Asia? And
Southeast Asia initially, yeah.
Okay, so which was your like favorite destination?
God, it's hard to choose. I love Indonesia. I went to some very remote places there. The kind of villages where they'd never seen a Westerner before. And no one speaks English. That was quite fascinating. I really like the Philippines. It's very beautiful, very scenic. Yeah.
So what do you do on like your free time when you are not at work and you're in Singapore,
You'll see me hiking or Latin dancing.
Okay. So do you have long-term plans to be in Singapore for?
Yeah, I guess. Quite settled here, so.
Okay. Are you PR?
Yes.
Yeah, PR. Okay. So, another thing that I was thinking about was that, we saw the Malaysia elections, right? And we all know that, actually, because in Singapore we have like one government for so long, we kind of tend to forget that in a healthy democracy, you can actually come up with an alternative view. And you can ask people to support your manifesto, and so if you have very strong views on like smoking and on like drugs use, recreational drug use, no one's stopping you from coming out to campaign and say that, if I win the elections, I would make weed legal in Singapore, for all the for all the young people. But because we have been so conditioned and we are so conservative, do you think that Singapore is a very conservative society generally?
I think it is.
Okay.
Yeah.
Compared to
well, I'm from Netherlands, so I guess most places are fairly conservative, but to my standards. But yes.
Okay. What's the situation in Netherlands like for smoking?
Well,
policies?
actually, it was quite bad until recently, because one big problem was a lot of the people in government, including the Minister for Health at that time, were in deep pockets with the tobacco companies. So they were being funded for their political campaigns and whatnot, and prominent academics too. So then Netherlands was really slow, actually. Probably I would say one of the worst in Europe. Yeah. But then, there was this big expose. So there was a local NGO which exposed all of these ties, all of these financial ties with tobacco companies, and really kind of named and shamed them very publicly. And that started to turn the conversation, yeah. And then there was talks about a lawsuit against the tobacco companies, and now there's been a huge shift. And also they started talking about this tobacco-free generation. So they're contemplating doing that in the Netherlands now too. So since then, I would say Netherlands has really progressed a lot. And I think Netherlands, once they decide that, yes, this is a party issue, they're pretty organized. Much like Singapore, once they've made up their mind, they're pretty good about making it happen. So yeah, we do see a big shift there now as well.
Yeah, one of the best things about Singapore politics is that funding is very strict.
Right.
And I don't even know, but there's actually a spending cap per voter.
Okay.
that political parties can spend on their whatever advertisement, whatever election materials that they can spend money on.
I see.
Like in Singapore, typically it's like the banners and the billboards, and all.
Yeah.
But political funding needs to be declared, and you can't have. You have to if you want to be a political donor, you have to be like Singaporean, and you can't be like you have to declare them essentially every quarter.
Yeah, I think Singapore has very good anti-corruption type measures, right? And that's really limited the tobacco industry as well. So yeah, it's pretty good on that front.
Okay. Is there anything else you want to share with me or the audience on
Not
what?
off the top of my head.
Okay.
Yeah.
Okay. If not, I thank you for your time today.
Yeah, thank you.
Like I mentioned, I think that this topic on tobacco control, it's a topic that many people are interested in, and I'm just very happy to have you bring out another perspective other than the TFG approach. Are there any other significant groups that are doing tobacco control policies that you know of
In Singapore?
in Singapore?
Not that many, actually. I mean, in Singapore, as I understand, it's mostly top down. So the government would be the main ones. You know, Ministry of Health has Promotion Board, NEA on the public smoking issue. And then, yeah, there's Tobacco Free Generation, the NGO, which has been advocating mainly for that policy. But yeah, there's actually quite few of us. You know, not like in other countries where there's a very big NGO presence and where much of the work is coming from these kind of local organizations or from civil society.
I might be wrong, but my personal suspicion is that a lot of people, other than those that are being heavily affected by secondhand smoke, they are actually quite happy with the status quo, with what's happening today. That means with what the government is currently doing, they feel like, okay, it's fair enough. Like, the taxes and the clamping down on regulations, clamping down on like advertisement or point of sales and all. And also, we know that Singapore is very hard on retailers who are caught selling to underage. So, I think the retailers are now very careful as well. If someone seems like underage, they would really make the effort to check their IDs and all,
right,
to make sure that they're not selling. So most of the people are probably like quite happy with what's happening today.
I don't know, honestly speaking, I think, based on the research that we've done anyway, the surveys that we've done and, things like focus groups and interview work, I would say people are very trusting of the government. And, what was interesting is even when we interviewed smokers and they say, well, if it was so bad for us, they would have banned it by now for sure.
Yeah, that's one argument as well.
So
right?
yeah, they're expecting more almost. Yeah. And actually, what we also found is when we looked at people's opinions on different tobacco policies, like, okay, do you think we should make all F&B establishments smoke-free? Do we think we should make all apartments smoke-free? Quite a lot of them said that we should, and that more should be done.
The smokers themselves?
Lesser so the smokers.
Oh, okay.
Some would advocate for that, but obviously it was more popular among the non-smokers. But actually one survey we did, around 80% of the people said that, yes, we should make all apartments completely smoke-free in Singapore. So 80%, which is a huge...
Yeah.
And I do think that there are issues where people feel more should be done. And you can tell also from the kind of comments that we see, and especially, like whenever there's debates on regulating smoking in housing, you see a lot of comments from people who are affected by it, and they're saying, please do something about it because we've tried. And, in our research as well, we interviewed people who handle these kind of complaints, from the GRCs. And they're saying, this is one of the top issues that they're always getting complaints about is secondhand smoke in housing. And these people, they're stuffing towels under the doors and they're just wishing that the government will do something about it. So I think depending on, with tobacco policy in general, I would say people say that, yes, in Singapore, a lot's been done and the government has done very well in that respect, but that there are still gaps that need to be addressed. And I think, a big one is the secondhand smoke issue because it still affects so many people. And I think another one is the vaping issue, which we're becoming more and more aware of.
Yes.
The rules are strict here, but I think, honestly, enforcement's really lacking.
It's really lacking.
Yeah, because you look around and people are vaping on their motorbikes and in groups by the ITEs, you see it. It's pretty common now. Not as common as it would be had we had a legal market, but for sure it's still happening. And
it doesn't seem like they're quite serious about enforcing the
Yeah, I mean, yeah, having a law is one thing, but that doesn't solve the issue. It has to be enforced, and that's the same with any kind of rule where you're going to restrict behavior, right? It's the same with smoking bans, right? Having, say, the smoking ban in Orchard Road, you know, it's worked well because they were very well focused on enforcement in the first few months. You know, they were citing people. And they had a certain grace period where they could give people warnings. You know, so they enforced it very well, and that's why the ban works. But if they hadn't done that, you'd still see people smoking on Orchard Road for sure.
Yep.
So I think there's the same issue with vaping, right? Or maybe if they have the law and think, okay, this sends a strict message, job done. No, it still needs to be enforced. And also, not just from the seller side, but from the demand side. Yeah, because shutting down the illegal supply is one thing. But then also, I think it's also important to educate people on the rationale why this law exists in the first place. Because I think right now there's a lot of misinformation. Like a lot of young people picking up vaping because they don't think it's bad for them. They don't realize it's addictive. Many of them don't even seem to realize that there's nicotine in the e-liquid, right? So it's about educating them and, you know, letting them know like the health risks of vaping and potential ways in which it could affect their health, this kind of thing.
Okay. Because you have been so actively, you have this presence in the mainstream media, right?
Right.
That, you know, people read articles and all. Have there been people who write into you to just share, and is there a memorable one that you have received from
Not
just
generally.
everyday people? No, people don't write to you.
I'm honestly a bit of a social media dinosaur, so I don't tend to check on there much.
Oh, okay.
And no, I haven't really had that where people write in directly.
Okay.
Yeah.
Because I thought that would be interesting. Yeah, okay, social media dinosaur then, if you had.
There's certainly comments, you know, especially if it's a polarizing topic like vaping or the secondhand smoke issue.
Yeah.
There's usually comments, but I don't tend to check.
Okay, great. Dr. Yvette, thank you for your time today.
All right.
And if you have new research that that you are working on, please give me a call.
All
and
right.
we can have a similar chat, on the progress to this topic in future.
Yeah, sure.
Yeah, thank you so much.
Thank you.
Thank you.
Okay.
Ooh.
Alrighty. How long was it?